Go ahead.
Okay. Hello, everyone. I'm Renee Buffard. I'm a licensed clinical social worker and an equine specialist. My private practice is called Healing Hoofbeats. We practice out of Hartford, and we are opening soon, within a few weeks, another location in North Franklin, Connecticut. Um, I am here to talk to you about what equine-assisted psychotherapy is and who it works for. So there's a lot of different ideas about what equine-assisted therapy is. There's a lot of different modalities that work with the horses that may not necessarily be psychotherapy, but it is a therapeutic activity. So that's why there's a lot of different confusion as to what equine-assisted psychotherapy is. So this next slide talks about what it is. So it's an experiential therapy model. It's a relational therapy model. So our focus is always on the relationships that we have. Our belief is that what has happened in our life, whether it be a single incident trauma, whether it be that we're suffering from depression or chronic trauma, everything happens within the context of relationships. So when we work with the horses, we work on building healthy, mutually beneficial relationships. And that's how we begin to heal, is through making those positive connections. So it is a trauma-informed model. And most of what we do does come from working with the horses on the ground, but there's also some times when we do some mounted work too, which is really good for emotion regulation. Who are some good candidates for equine-assisted psychotherapy? So we work with individuals ages 5 and up, and that's just because a lot of the times when they're 5 or younger, they're very, very small in comparison to the horses, and there may not be a lot of impulse control. But what we do with kids that are under 5 is typically work with the smaller animals like rabbits, chickens. We have a lot of reptiles as well. We do individual, family, and group work. What we see a lot of the times is that people who come to see us to work with the horses have often had a hard time engaging in traditional talk therapy, and they often have better outcomes with the horses. So some diagnoses, but definitely we work with people who have many different diagnoses. Anything that you would go see a therapist to do talk therapy, we also see. But those diagnoses that we see a lot of positive outcomes are attachment disorders, depression, anxiety, autism spectrum, oppositional defiant disorder, substance use, PTSD and trauma survivors, borderline personality disorder, bipolar disorder, people with self-harming behaviors, and military-related symptoms. And like I said, we could really name any diagnosis and it would work, because when we think about it, we're working with the horses to form healthy relationships. So what equine-assisted therapy is not, it's not therapeutic horseback riding. And it's not learning how to ride horses or teaching horsemanship skills like you would if you were learning how to train horses. It's not companionship. So the horses don't always want to be with us if we're not being congruent. They get to make choices in their relationships too. So they're not with us 100% of the time if we're not present with them. So they may choose to walk away, and then we have to figure out how to get them to want to come back to us. It's not similar to dog therapy, and we're not just playing. So a lot of the times when we are working with the horses, it looks like play because that's how we start to learn, and that's a lot of the times how we can engage in some good relationships. But there's a lot more to it. Okay, so how does it work? So horses are an ideal partner in animal-assisted therapy because they elicit different communication styles than what we're used to. So they focus just on nonverbal communication. So our body language, our proximity to them, they are non-judgmental, and they're very accepting, and they don't label us, and they don't care about our symptoms. All they care about is that we want to be with them. While mostly domesticated, horses have maintained much of their wild instinct when it comes to reading others. and through the bonding process. The horse's responsive nature makes them an ideal therapy partner because they're naturally curious and they have their own individual personalities. Some people say that they can mirror our behavior, and some say that they are responding. So a lot of what we feel internally is what they exhibit, and that's because they're responding to what we are feeling. So it can look like a mirror, but we don't want to discredit their choices. And it's often difficult to talk about trauma and difficult experiences. So when you're with the horses, because it is experiential, there's not a lot of talking going on. The focus is really about bonding with the horse and creating a healthy relationship. And through that process, you learn mindfulness, emotional regulation, how to respond calmly and not impulsively to cultivate the relationship, and all of which can be difficult for trauma survivors or those experiencing a myriad of different diagnoses and symptoms. So these skills, once we practice them with the horses, because again, it's an experiential model, they begin to happen within our relationships outside of working with the horses. So sessions can consist of a clinician and an equine specialist. In some cases, this is two people. So a therapist who may not have a ton of horse experience and an equine specialist who is not a mental health professional. Other times, it can be one person who's duly certified. So myself, I am a mental health professional and an equine professional. So when I'm working with individuals, I function in role. When we have groups, there's always two people. So there's always one acting as the mental health professional and one acting as an equine professional because of the number of humans and horses. Let's see, some sessions consist of client being given an activity to complete with little further instruction or guidance. Other times it's very client driven and we're asking the client, how would you like to start your relationship with your horse and what are some important qualities? And then how do you go about that? So at the close of each session, what we do is discuss how it went, what the client noticed, what the equine and mental health professionals noticed, and what are some themes within their life. A lot of this comes up very organically. And the clients will often bring up metaphors created throughout their session, which would rarely come up in talk therapy. So it could be that my horse Joey acts just like my father. And then we talk about, okay, well, so what are some of the behaviors and what part do you have in that? Okay, so now we talk a little bit about mounted work. So when we do some mounted work, it's not about teaching riding skills and how to move left and right and how to trot or canter. It's about the connection with the horse and the relationship with the horse. So if you're familiar with EMDR or eye movement desensitization reprocessing therapy, the effects on the brain are very similar because when you are mounted on the horse, their body makes our body shift right and left, and that stimulates the right and left hemispheres of the brain. Let's see. So when that mounted work is happening and the bilateral stimulations are happening, that's rewiring the damages that's happened through trauma so that we can make those new positive connections. And clients who have reported that the traumatic event and its PTSD symptoms decrease dramatically and often say that the images, like their flashbacks or the memory of the event, changes or can become distant. So it's not as charged as it has been. So we offer a bunch of different groups, and we are always in the works to making more. So we have a resiliency group for teens, a parent support group, coping with mental health, Horses Healing Heroes, which now we have actually changed the name, and it's called Operation Warrior Horse, which we have developed and work with veterans to help their healing process. We have empowerment groups, socialization groups, groups for those who have been victims to domestic violence, those who have eating disorders or self-injurious behaviors, those who engage in substance use or have depression. And we also do corporate and agency team building workshops. And that is the end of our slide. So that is just a taste about what equine assisted psychotherapy is and how it can help